And now it's my very great pleasure to introduce a conversation between two people I admire a great deal. In all the years I've been doing this, my introductions to one of them have been getting shorter and shorter. That's partly because he's a very modest man, and it's partly because you all know him very well. So I'm just going to say, please welcome our founder and the person without whom we wouldn't be here. Jeff Skoll, hello. Hello, Jeff. Jeff will be joined by Dr. Jim Kim. Jim co-founded Partners in Health. Go and see, by the way, Bending the Arc on Wednesday in this very theatre. He won a MacArthur Genius Prize in 2003, and he is, of course, the president of the World Bank. The World Bank was created in 1944 at the Bretton Woods Conference with two very simple goals: to decrease the number of people living in poverty and to foster income growth for the bottom 40% in every country. It's now a huge organization with 10,000 employees in 120 offices around the world. Paul Farmer, well known to you all, describes how he and Jim used to laugh at the motto carved over the entry to the World Bank headquarters. And that motto reads, "Our dream is a world free of poverty." And Jim said to Paul, "Let's change it from a dream to a plan, and then we don't need to mock it anymore." That sounds like a plan. Please welcome Jim Kim.
Yeah, thank you. Welcome. Well, thank you so much, Jim, for joining us. And I've realized how complex the world of the World Bank is. And you're the first physician, anthropologist, social entrepreneur who's run the World Bank. And growing up as a kid in Iowa. But I have one question. So I've had the privilege of traveling the world the last decade. I've been to all 7 continents and some many times. I've never seen a branch of the World Bank. What's up with that? No ATM. But I'd love to start with something Stefan referenced, a film that covers a lot of ground in your history. It's a film called Bending the Arc, about Partners in Health, which Jim co-founded with Ophelia Dahl and Paul Farmer. And the film was a partnership of the Skoll Foundation and the Sundance Institute. And I've chosen a short clip to kick us off.
Sure.
We chose that clip because it really represents your days fighting for the resources to address the sick and the poor and the forgotten, and going up against the halls of power to gain these resources. And now, some people see you sit in the halls of power. How does that influence the way you guide the World Bank?
Well, Jeff, let me tell you the story of how I got the job, because it came completely out of the blue. Tim Geithner, who was Secretary of the Treasury at the time, he called me, and I was president of Dartmouth at the time, and Tim was class of '83 of Dartmouth, and the only reason he ever called me is because he had a friend who had a kid who he wanted to get into Dartmouth. Right? So he called me and he said, "Hey Jim, would you be interested in being president of the World Bank?" And I said, "You mean the World Bank?" He said, "Yeah." And I said, "Well, what do you want me to do?" So, "Can you come down and talk to the president?" And I said, "When?" And he said, "How about tomorrow?" So I did actually go down, and I was sitting there, and they had a copy of a book that I had edited along with Paul Farmer. Is Paul and Ophelia, are they here now? They're here somewhere, right? All right. And so it was called Dying for Growth, Global Inequality and the Health of the Poor. And it was essentially a 500-page screed against the World Bank. And I had actually been part of a movement called 50 Years is Enough, in which we were trying to close the World Bank on its 50th anniversary. And so I had this out-of-body experience where we don't go through Senate confirmation, but the president doesn't want to put someone up who then will embarrass him. So they were doing a huge background check of me, and they had a copy of Dying for Growth. These lawyers, brilliant lawyers, who were asking me all kinds of questions, and they had a copy, and every page was read, was earmarked, and I looked at that and I said, oh, so am I not a candidate anymore? And they said, no, it's okay. Now, I have to say, it would only be President Obama who would do that. Let me just take a drink. But then let me, so then I walked into the Oval Office and there's President Obama. I'd never met him before, and I'd been obsessed with him since he made that speech in 2004. And so the first thing he did is he sat down and he said, well, Jim, you're a physician and an anthropologist, and people are all telling me that I should hire a macroeconomic, or I should nominate a macroeconomist. And so, there are people, and he actually mentioned my friend Ernesto Zedillo, who's here, I think. He said, what am I going to tell people like Ernesto Zedillo, that I hired you instead of a macroeconomist, to be the president of the World Bank? And I said, well, President Obama, have you ever read your mother's PhD dissertation thesis? I was such a nerd that she had done her PhD in anthropology, my field, and there was the only way to get her dissertation was to write to the University of Michigan archives, where they keep all the PhD dissertations. And I was like one of 5 people who had ever requested her dissertation, and I read the whole thing. And he said, well, yeah, I have read it. And I said, well, you'll then know that your mother wrote that the Indonesian artisanal industry, which she studied, everyone predicted that globalization would wipe it out. But her 1,000-page thesis showed that, in fact, the Indonesian artisanal industry flourished with globalization. And I said, I'm not going to give you the view from 30,000 feet like a macroeconomist would, but I've been on the ground for 25 years, and I'll tell you how the programs are working on the ground. He looked at me and he said, I get that. And then later, about a year and a half later, we were having a beer somewhere, right? And he said, Jim, that was the best ploy to get a job I've ever seen. All this to say, Secretary Clinton nominated me. Tim Geithner, my Dartmouth buddy, seconded it, and it was President Obama. I don't think that very many heads of state would nominate someone who actually tried to tear down the institution 20 years before. So I'm just very grateful. I'll always be very grateful to President Obama.
So it was a very straight and direct path from childhood to head of the World Bank with no bumps along the way.
But let me just say, I hope everyone comes to see the film tomorrow night, because in fact, the spirit of Partners in Health, and it's really, if I could sum it up in 2 ways. One of them, and you'll see in the film, is this notion of making a preferential option for the poor. Now, that comes from Catholic social teaching, but we were an organization that had people from every faith, people from no faith, and what we had found over years is that this notion of, well, what does it mean for the poorest? What is the right thing to do for the poorest of the poor? That always worked for us, because it suggested that there were things that it was not a preferential option for. It's not a preferential option for your own idea, right? And we saw so many people come to us and said, the poor are poor because they haven't really listened to my idea, or a preferential option for a particular group. It's a preferential option for the poor, and it's the hardest thing to sort of remain true to. And the other part is because we were embedded in Harvard Medical School in Atul. We were residents together in Brigham and Women's Hospital, and what he's showing you is, and we've worked together on this notion of a science of delivery, is that you've got to look at the evidence. What is the evidence, and can the evidence lead us to the right conclusion about making a preferential option for the poor? And those two ideas, I have absolutely not swerved from those two, and those are the fundamental ideas that still drive the work we do today.
Well, I think it is probably no fluke of history that sometimes the right person comes into the right place at the right time. And as many of you know, in 2014, there was a global pandemic in Ebola, and the epidemic became a pandemic because the world was a little slow to get off the ground. Doctors Without Borders had found it, reported it to the WHO, which had been drastically cut and was a little slow in responding. But all of a sudden, we have a physician who spent his life in health at the head of the World Bank. Jim, I wonder if you want to tell that story.
Well, it was, I'd heard stories about the Ebola outbreak, and that's not what the World Bank does. We do not respond to outbreaks, and we don't respond to short-term emergencies usually, because that's not what we do. And so I just kept thinking, they must be on this, because I was actually at WHO in 2003 during the transition period for J.W. Lee, who I worked for at WHO, and I remember the fantastic team that was taking care of SARS, and I said, well, where's Mike Ryan? Where's David Heyman? Where are all these guys who have been so great at responding to epidemics? And it turns out that they'd all left WHO. And that was the first sign. But then I called Paul, and as I always do, I call Paul. And Paul had been on the ground, and he just said, Jim, I have never seen so much virus anywhere. I've never seen anything like this. And so Paul's seen everything. So when he said that, I thought, oh my God, now what do we do? So I started calling around saying, well, where's the response? Where are the literally hundreds of millions, if not billions of dollars? Because it's once there's that much virus in the system, which is what Paul told me about, is that once there's that much out there, there's just very little that you can do unless you mount a massive effort, and there was nothing going on. So I talked to my board, and I said, this is not what we normally do, but if we don't send a message, no one's going to do anything. So on August 4th, 2014, we announced that we were going to provide $400 million to fight Ebola, and we got the money moving within 9 days. Right? Now, anyone who's taken a loan from the World Bank knows that that's right. That's why we don't have ATMs, by the way. So we moved the money in 9 days, and there was an excitement. And frankly, again, we are not the ones who do this, but I did things like I called Mike Ryan myself and said, Mike, you got to get back in. You got to help us with this, because he had been involved in the response to every Ebola outbreak in history. And he was on the sidelines working in another organization because the board did not support WHO to scale up its efforts on pandemics. But at the end, what we ended up putting $1.6 billion into just the immediate response, and the overall thing cost about $10 billion. The question I asked was, can't we do this better? Isn't there a way of building a fail-safe instrument that the minute something gets bad, it automatically releases? So I went and talked to the reinsurance companies. That's a great thing about this job. Just about anyone will talk to me, even Jeff Skoll will talk to me. And so I talked to the CEO of Munich Re, the reinsurance company. And Nicholas von Baumhart, a great guy, said, we would love to be part of that conversation, but we're never invited to participate. And so the great Paul Pullman, I know he works with you guys. I said, Paul, can you organize a meeting at Davos where we bring public health people and the reinsurance industry together? And so they brought them all together, and we started saying, why don't we have an insurance instrument that will release automatically once the epidemic reaches a certain level? And so we asked the insurance company folks, and they said, look, we can insure anything. And for us, having insurance in the picture will help us because then we could potentially avoid not only the life insurance policies that they would pay, but the thing that kills them is the business disruption policies, because that's what happens in a pandemic. Businesses just shut down. And so they kept at it, and we kept saying, oh, it's so complicated, it's so complicated. But we put people in a room for about 5 months, and they came out with a set, not all at once, but over a period of 5 months, they came up with parametric triggers. And so we've come up with a new instrument that's called parametric insurance. It's not the usual claim-based insurance. Something bad happens, you make a claim, and they give you money. Once you hit certain triggers, the money will automatically release. And at first it was so complicated, but then the insurance company guys kept saying, you know, everything is complicated at first. Automobile insurance was really complicated when we first started it. We didn't know that seatbelts were effective. We didn't know that speed bumps helped. We didn't know that shoulder harnesses were even better. But it was great because there was a synergy. The insurance industry was interested in keeping people safer so they didn't have to pay more claims. And so now the insurance industry is interested in preventing a pandemic so that they don't have to pay more claims. The incentives are aligned. And so by May of this year, we will put into force a $500 million parametric insurance policy for the 88 poorest countries in the world. So this will never happen again.
I'd like to just pause on that fact for a moment. You know, in August of 2014, thanks to Jim, Ebola, which had already had a head start, and you know, did quite a lot of psychological damage and some real damage in parts of the world, was stopped, or the genie was put back in the bottle, and Larry Brilliant, who was running this Global Threats Fund at the time, and Mark
one of my
Smolinski,
heroes, by the way. Yeah.
Yes.
By the way, Atul talked about the science of delivery, but Larry was the one who I credit was starting the science of delivery. He wrote a book about smallpox eradication. That it was the very first book that showed us that management and systems is what's critical for public health. So Larry,
yes.
Thank you.
And Larry always said, you know, he took credit for putting out the Ebola crisis, and gave you props to. No, so Mark Smolinski, who works with Larry and runs the pandemics program of our group, you know, the goal has been to end pandemics. I like to say that epidemics happen, pandemics are optional. Yeah. And so what you've done is put in place something that can get us to a place where we may never see another pandemic.
Well, it's just one part of it, and we're still not ready, right? So this is one small part of it, but it's a pretty important part, meaning that we don't have to wait until countries decide to be generous, right? So just to, you know, we created a cash window, which can be released for any reason. And so that cash window should have released really in December of 2013 when the first cases, and we could have put it out then. But it would have definitely, even if that cash window hadn't put it out, it would have released at a point that the epidemic was 10 times smaller than what it was when the first money actually was released. So that you know, it's there, but still, I mean, Larry knows more about this than I do, but you know, the system is not there yet. We don't have a system of making new vaccines. We don't have a surveillance system that works in all the countries of the world. So we're still far short of it. And it's just because, you know, what always happens is pandemics are panic, neglect, panic, neglect, panic. That's what happens every single time. And so what we're trying to do is to say, at least this, you know, the insurance instrument, when I first talked about it after the Ebola epidemic, we had 15 donors. Oh, of course, we're going to definitely do this, right? At the end, we only had 2. Only the Japanese and the Germans could remember that this was an issue at some point. Right. And this happens every single time. Every single time it happens. And so right now, the scary thing is we're in this lull. And at least we have the insurance instrument. There's more going on, but we're not ready. We're really not ready.
Well, I wanted to also, I know we only have a few minutes left, but you know, the World Bank, as I've learned, the more I've come to know you and understand you know, the organizations that make up the World Bank group and how it touches just about every place in the world. You know, beyond health, there are a number of initiatives that you care about. Wonder if you'd like to talk about that.
Yeah, you know, to try to tie together what you know, the great presentations by Winnie and Hamdi, you know, the book by Thomas Piketty, right? Capitalism of the 21st Century. Capitalism of the 21st Century is the nerdiest 600-page book you've ever read, right? And I actually, because of my job, I read the whole thing, but it turns out that if you look at Kindle, Thomas Piketty sold huge numbers of Capitalism of the 21st Century, but it has, you know, they track how far you read in Kindle.
Right.
It has the tiniest proportion of actual readership, right?
Right.
But in it, he says that capital will always grow faster than wages, so we're doomed to increasing inequality. But on one page, page 21, he says, but if you can move capital from rich to poor, and you can improve the quality of education in poor countries, and you can link capital to knowledge, then you can actually see things growing in other places. And so right now, the most important thing that we're trying to do is play the role that I think both Winnie and Hamdi talked about, right? We have to be the honest broker that sits between the global market capitalist system and poor countries. And right now, there are huge win-win situations. Trillions of dollars sitting in negative interest rate bonds. So in other words, you pay Germany to keep your money for you, right? And so pension funds and insurance companies are desperate to get higher returns. And we know that there are potentially very solid returns in developing countries. But we cannot let what happened in the past, which is mass privatizations that were very bad for poor countries. So we're now trying to change everything we do to be the facilitator, to make sure that the capital, and we will attach knowledge to that capital, can move to developing countries to create these win-win situations. Because, you know, if we don't, we're in a lot of trouble. I mean, you know, I know we're out of time, but if I can go, look, you know, one of the things we're seeing,
out of time, Jim.
one of the things we're seeing, and it's great to see, is that aspirations are converging in the world, right? And we have 3,000 PhDs at the World Bank, and you ask them a question, and they get at it in such an interesting way. And I just said, I see aspirations converging all over the world, and I'm really worried about it because unless we move more quickly in fighting poverty, unless we move more quickly in creating jobs, thwarted aspirations could turn to something really negative. Right? And so they went back and they looked at all the research and they said, you know, in fact, it is happening. And here's what it is. It's very cool that if your reference, the income to which you reference yourself goes up 10%, unless your own income goes up half that, you become very dissatisfied, right? But here's what's happening, that with access to the internet, people are now happy to get access to the internet, but are now much more likely to want to migrate and much more likely to see that their reference income is not just the people around them, but a global reference income, right? So aspirations linked to opportunity yield dynamism. Aspirations linked to frustration yield, you know, conflict, violence, extremism, all the things that we don't, that we worry about. And so I just feel this huge sense of urgency to make the system work as Winnie would like to see it work, and to make the system work as Hamdi has made it work. Right. But there has to be a group of us that says, look, you know, if Xi Jinping says, and he said recently, I'm the leader of the largest communist party in the world, and I want to tell you that global market capitalism is the ocean we all swim in, and any effort to turn it into lakes and rivers will fail, right? So just ask the leader of the largest communist party in the world how the system works. That is the system, and our role now is to make it work for everybody. Now, that's going to be very, very difficult, but it's, I think, you people here, the social entrepreneurs, who are going to make this work. Now, let me leave you with one final story. I was in Tanzania, and as I always do, I go to, I visit some social project, and this time I visited a school, and there were 11-year-olds, and they stood up, and I asked them, what do you want to be when you grow up? And 2 out of the 4 students who stood up said, "I want to be president of the World Bank." Right? Now, and here's what I told them. I told them, you know, in 1959, I was born in Korea. And Korea was one of the poorest countries in the world. It had a lower GDP per capita than Ghana or Somalia, and had about the same GDP per capita as Kenya. I went back and looked at the archive reports from the World Bank about Korea in 1959, 1960, 1961. And in it, they say Korea is essentially a hopeless country. They're way too Confucian. They have no industrial base, right? No industrial base. It's mostly an agricultural country. The rate of illiteracy was about 80%. And so they said that they wouldn't be able to pay back even the lowest interest rate loans. So they're ineligible for a loan from the World Bank. 1959, 60, 61. 62, they started considering Korea. 63, they got their first loan. And so I said, in 1963, I was a kindergarten student in Korea. And I doubt that if the World Bank president had visited Korea, that he would look in that classroom and think that a future World Bank president was sitting in that classroom. So don't ever let anyone tell you here in Tanzania that you can't be president of the World Bank Group. Now, you know, the task is much harder now. The convergence of aspiration means that very soon you're going to, and Jeff is always teaching me things, but he, you know, internet access is going to be global very, very quickly. And so you're going to have 7.3 billion people in the world who all want a more or less middle-class lifestyle. And if we don't meet those aspirations, you're going to see some very ugly situations in the world. And so right now, what we're trying to do is to say, if the leader of the largest communist party in the world tells us that we've got to make global market capitalism work for everybody, we should probably listen to him. And we should probably try to be as creative as we can possibly be. See, pandemic insurance was using the tools that the rich use every day to make themselves richer on behalf of the poorest people in the world, right? And there's more, guarantees, swaps. There's so many tricks. And you know, I felt embarrassed after a year at the World Bank. How could I have been around, talking crap like, close the World Bank, and have not learned about finance all these years? Because finance is what's going to make the world work and the system work for poor people. So what I would say is, all of you in this room, right? Learn how this stuff works. Exchange rate risk guarantees for Zimbabwe or Zambia could be the difference between ending poverty and not. You got to know what they are. You got to know how they work. You got to know how to demand that we put them in place for the poorest of the poor as well. I'm worried. The convergence of aspirations is great. Everyone should be able to have the experience that I, as a Korean American, have had. But in the path to getting there, if we don't find ways to make the system work for everybody, we're going to not leave a very nice world for our children.
Jim, I'm going to wrap up with a comment that one of the most amazing things about you, and I learn this every time we talk, is that you believe that everybody in the world has the potential to be a change maker, and that everybody in the world should have the opportunity to improve their lives. And that's something that's shared with all of the social entrepreneurs in this room, and you bring hope. And social entrepreneurs bring hope and inspiration. You are a social entrepreneur. You're also in the right person in the right place at the right time, and we hope you keep doing this as long as you can. Thank you very much.
Thank you.
Thank you. This is so cool.